Namaste, I am Dr. Rajesh Palwai. I am consultant pulmonologist in Prasad Hospitals, Nacharam. I deal with the problems and diseases of the respiratory system. The lungs are vital essentially for maintenance of life. So, if you see, whenever some person passes away, we call him as expired or his last breath, he had his last breath. It means it shows the importance of the lungs. But unfortunately, these are the organs which are affected by the outside pollution and the habits of the people, and it causes many other diseases. And the main symptoms of the respiratory symptoms will be cough, short of breath or dyspnea, or not able to breathe properly, and chest pain, blood in the sputum. These are the main symptoms. So whenever some person gets this kind of symptoms, for example, cough can be seen as a normal thing for many patients, but it is absolutely necessary to consult a doctor if cough persists for more than 1 week or 10 days like that, and the chest pain and everything. And if we identify these problems at the early stages and if we take proper treatment, we can clearly prevent it from the progress to more chronic ones and life-threatening ones. The diseases mainly we deal with are bronchial asthma, COPD, which means chronic obstructive pulmonary disease, which many people call it as a smoker's lungs or chronic bronchitis, and pleural effusions, which means accumulation of fluid surrounding the lungs, and pneumothorax, which means accumulation of air surrounding the lungs, and many lung cancers, which are caused mainly by the smoking and the outside air pollution. And there are many occupational diseases. For example, those people who work in the factories, some kinds of factories where fumes are there, and these people may get some kinds of diseases which are called as the interstitial lung diseases or pneumoconiosis. And these are all the diseases which we deal with. Above all these diseases which were there from the long time, now we are getting new kinds of influenza infections like swine flu, and in the recent past we have a COVID pandemic which is troubling the whole world without any discrimination. Respiratory system or the lungs are affected by the age-old diseases like tuberculosis up to the newly evolving disease like COVID-19. And we are trying to treat all the diseases, we are trying to find the remedies for all the diseases. In spite of that, there are new diseases which are causing a lot of problem to the world. And as many doctors say, prevention is better than cure. The two lung diseases which can be prevented easily are lung cancers and COPD. By decreasing or stopping smoking and decreasing the air pollution, we can prevent these two diseases. Nowadays, the prevalence of these two diseases is increasing as many people are newly habituated to smoking, and the air pollution is also increasing due to urbanization. So we can prevent these kinds of diseases by stopping smoking and decreasing the air pollution. Bronchial asthma, this is a disease which is manifested by the cough, short of breath, wheeze, and chest tightness. So it can affect all the ages of people, from the infants up to the old age 80 or 90 years. So there is no age discrimination for this disease, and it can be turned into a chronic one which can cause multiple other complications and decrease in the quality of life. The early identification of the problem and proper treatment is important to prevent its chronicity. Tuberculosis is a disease which causes cough, expectoration, and decreased appetite and loss of weight. Whenever some person is having a cough which persists for more than 1 week or 10 days, better to consult a doctor and to get cleared about the tuberculosis, because it is highly endemic in India. The COPD is a disease which affects the lungs airways, causes the over-secretion of the mucus and obstruction, decrease in the airflow, and decrease in the compliance of the lungs. It is mainly caused by smoking and some amount of air pollution also. So any smoker who is having persistent cough and short of breath should consult a doctor, and before that better to stop the smoking, even at least after consulting the doctor, and take proper treatment, because if COPD is untreated, it will lead to life-threatening complications like exacerbations, respiratory failure, and cor pulmonale. Obstructive sleep apnea is also a disease which is dealt by the pulmonologist, and this is highly underestimated because many people may be having this disease. It manifests as a snoring, highly snoring during sleep, and excessive daytime somnolence or sleepiness. For example, some persons will be just like that going into the sleep while driving, while talking to some other person, while watching TV. And these people, if they have snoring and all, it is a sign for obstructive sleep apnea. This is also a disease which has to be detected early and to be corrected. we have integrated team of pulmonologist, ENT surgeon and bariatric surgeon, which is not available at many places, so that we can treat completely about the obstructive sleep apnea at Prasad Hospitals. And coming to the COVID-19 disease, it can mimic any disease like common cold, or there may be no symptoms at all also, and in no time it may progress to life-threatening condition. We have limited exposure, in the total world also we have limited treatment modalities which are totally not established. So even then we have to give the proper treatment, we have to detect it early so that it is communicated to the other, it is not communicated to the others, and early interventions can be done so that it won't become a life-threatening condition. So in this pandemic situation, any person who is having cough, cold, body pains and short of breath, better to go to the doctor and get tested for COVID-19 as per the advice of the doctor. The facilities which are provided from the Department of Pulmonary Medicine in Prasad Hospitals are pulmonary function tests like spirometry and bronchoscopy. We can diagnose any lung cancers also by taking the biopsy, by going into or seeing into the bronchial tree, and we can aspirate the fluid from the lungs, that is thoracentesis and ICD insertions, and we offer polysomnography, which is used in diagnosing obstructive sleep apnea, and we can do thoracoscopy also, which is done in undiagnosed pleural effusion cases.